Low sperm count means fewer sperm are produced, making fertilization difficult.
Sometimes the testicles don't produce enough sperm due to hormonal imbalance or health issues.
Even when sperm are present, weak movement can prevent them from reaching the egg. Low testosterone and hormone imbalance can reduce sperm production significantly.
Swollen veins around the testicles can raise heat and damage sperm quality.
Smoking, alcohol, stress, and poor lifestyle can weaken sperm and lower fertility. Past infections or medical conditions can damage sperm and block fertilization. Sometimes sperm cannot travel properly due to blockages or genetic conditions.
The good news is, many causes of low sperm count can be diagnosed and treated.